Hi, I'm Walla Walla Public Schools Superintendent Miller, and welcome to the Pulse for June. Well, the 2013-14 school year is almost in the books, and it's been a great year, and we are so thankful for an outstanding teaching staff and great students here in the Walla Walla Public Schools. Now, last month we had our bond election, and we want to thank everyone who did vote. Now, we only had about 45% of the population voting in Walla Walla. We need to improve that. We need to get a greater voter turnout in the future. So, boy, when those ballots are coming and hitting your mailbox, please in the future make sure that you're marking those down. But for those of you who did vote, thank you so much. Now, just under 53% of the population voted in support of the bond election, but to pass a bond election in the state of Washington, we needed 60%, and we didn't get to that number. As a school district, we're going to regroup, we're going to listen, we're going to be focusing in the 14-15 school year on developing another plan on how we address our facility needs, because those needs are still out there. Well, when we started the Pulse 2 years ago, we wanted to introduce you to our principals. This year we've wanted to focus on our support administrators. And today we're going to hear from Jennifer Douglas, who is our Health Services Director. And next year we're going to focus on students. We really appreciate you coming along with us on the Pulse over the last year, and we're excited to introduce you to Jennifer and Health Services today. Welcome to the Pulse for June. I'm with Walla Walla Public Schools Health Services Director Jennifer Douglas, who's in her 12th year with the school district. And Jennifer, how many nurses do we have in our district, and what kind of qualifications do they have?
We have 9 nurses and 10 schools, so some of the nurses go to some of the other schools or programs. And the qualifications are that we have a nurse in every building that has a professional license, actually. Some LPNs, bachelors, even master's degreed nurses.
Wow. Now, what are the primary job functions for our school nurses?
Well, one of the most important things we do as school nurses in schools is to assess a child's health. And what we do with that is we make recommendations or implement interventions that will keep a child in the classroom and learning. We are liaisons between the family and the school meaning teacher and teaching and learning.
Right.
And we also, we can't fix the health problems, although we have expert knowledge to be able to help families and teachers and students to cope with these conditions at school. We also have knowledge to give teachers tools to care for these students' health in the classroom.
In the classroom.
Yeah.
Well, now in terms of, we've got 9 nurses in 10 schools. How many visits? How busy are our clinics?
Well, from the first day of school until now, we have had over 30,000 clinic visits in all our schools.
That's incredible. When you think we have 6,000 students in Walla Walla Public Schools, that easy math, that's about 5 visits per student. What kind of changes have you seen in terms of school nursing over the course of your career?
Well, I'll tell you, we have a lot of mandates that we are expected to adhere to in health services. And these mandates are mandates that only nurses, actually professional nurses, can provide. Yet the state doesn't provide funding for school nurses. So it's kind of a catch-22. It's really difficult to make sure that things get done appropriately. And
so when kids are coming down, when they've got sniffles or they're not feeling good, the nurses are taking care of them in that way as kind of before. But you were talking with me off camera about like a critical care plan. I know when I was first a school administrator 20 years ago, there was no such thing as a critical care plan. What are those?
Well, we have over 300 life-threatening conditions. And if students that have a condition that would be life-threatening would put them in danger of being at school without a medication or a treatment order.
So like an allergy or something along those lines?
Food allergies or asthma, diabetes. We check blood sugars. We develop plans so that when we're not in the building, that teachers and others can care for this child for continuity of care. We want to know that this child is doing well in school.
Wow.
So,
I mean, that's a huge change from a few years back. Where do you see the challenges, as we go in the future?
I think it's really important to remember that children need to be healthy to learn, and they need to learn to be healthy.
Sure.
And I think learning to care for their own health. And it just takes the whole team to do that. You know, we work closely with the whole team. We make those referrals to develop plans and to discuss student needs. And health comes front and center.
Right. Well, we're working really hard with a health committee, and our nurses do a great job. I didn't know until you just said that 30,000 visits. That's an incredible number. I just want to thank you as well as the school nurses for all the great work you do.
Thank you.
Thank you so much.
Yes.
Thanks to Jennifer, and thanks to our outstanding nursing staff. The amount of work that they do, 30,000 visits in the year, it's really incredible. Well, our school year is coming to an end, and congratulations to the graduates at Walla Walla High School and Lincoln High School. Also, congratulations to our students for finishing another school year. And as we end the Pulse for the year, I need to do some thank yous. I would like to thank Mark Higgins, our communications director, for putting this together. Dinah Morrison from Charter Communications for all her work in putting this together. Thank you to our teachers and staff for the outstanding job they do each and every day in support of our children. And thank you to our kids. We really have wonderful students in Walla Walla. But we couldn't do this without the overwhelming support of our general population and public who support our levies and support our bonds and help us to educate kids in Walla Walla. It's a wonderful community to raise children. Thank you so much. We look forward to seeing you in September when we start up again next school year and with another edition of The Pulse. Have a great summer.